I'd like to welcome Christine Cruz from St. Jude's to talk about equipping residents and fellows to deliver the future of precision.
Okay, so thanks, Dr. Wiesenen, for laying the groundwork on what we're doing in our schools. And so I'm Christine Cruz. I practice at St. Jude Children's Research Hospital, where I'm the residency program director for our specialty pharmacy residency in clinical pharmacogenomics. So I'm going to just continue the conversation and talk about how we're doing with equipping residents and fellows to be the ones to deliver the future of precision medicine. Here we go. Okay, so I'm just going to sort of define and discuss for you the differences and similarities in residency, fellowship, and certificate programs in pharmacogenomics in this session. So I just wanted to start by kind of polling you guys. So how many of you here in the room have completed formal training in the field of pharmacogenomics by a show of hands? Pretty good. I would say about a third of you. So congratulations. You guys are the future of our field, right? So you guys are the ones who are going to continue to be innovators and advocates for the field. So that's great. So by a show of hands, how many of you are involved in training trainees in pharmacogenomics? Excellent. So an even larger percentage of us. I am too. So I don't have formal training in pharmacogenomics because my training came in the early 90s. I did my residency and fellowship training before there was formal training in pharmacogenomics. And my career has sort of grown up with the emerging field as it has grown up. So, you know, just lots of changes have been taking place. So I just want to kind of advocate with you and for you that if we're going to continue to advance our field of precision medicine, we really have to focus on training the next generation and training them not just in the knowledge and the skills to interpret pharmacogenomics, but also to be leaders, to be innovators, and to be advocates for our field, right? And so like we heard yesterday about the 3 pillars of Sanford's program of research, clinical research, which we're all involved in implementation and patient care, and then also in training the next generation is equally important. So the American Society of Health System Pharmacists published a statement on the role of pharmacists in personalized medicine, and that is that pharmacists have responsibilities that include promoting the optimal use and timing of the tests, interpreting the test results, and educating other healthcare professionals, patients, and the public on the field. Really establishing that not just clinical pharmacists or not just specially trained pharmacogenomics pharmacists, but pharmacists are the frontline experts that need to be able to talk the language and advocate for testing and how to interpret the results. So there are many different paths towards being trained in pharmacogenomics. And so just for as many people as there are in this room, there's probably that same number of paths of how you all arrived as an implementer in this field, right? And so there's no one particular way, but I'm just going to kind of briefly break down the different paths, and then you know, we can have a conversation about what you're seeing maybe in your practice. So just to start with residencies. So ASHP is the American Society of Health System Pharmacists. It's the accrediting body for pharmacy residencies. And pharmacy residency training is essential for a pharmacist that wants a role in clinical care. It's really the way that we're going. We continue across the nation to see strong interest in residencies. And I was able to see the metrics from this current spring's residency match program. So over 5,800 individual pharmacists matched with over 2,000 pharmacy residency programs this spring for the coming year, for 24-25 residency year. And then we're also able to see a higher share of graduating students, 46% applied to the match than did last year, which is good because we're starting to come back up. We did have a dip over the past 5 years or so, and so it's nice to see that that's coming or leveling off again. And just, for some nomenclature, in case you're not used to talking about residency training. So like medical training, pharmacy residency training has typically a postgraduate year one is going to be, a postgraduate year one is a more broad exposure to different clinical areas, and this is typically your first year out of graduating from pharmacy school, and there are standards that have to be met. A pharmacist who's interested in specializing in a specialty area then can choose to go on and do a postgraduate year two. It's not required. If you have an interest in a specialty area, this is where you begin to specialize, and we call it a PGY2. And there's particular aspects to that. So in the field of clinical pharmacogenomics, in 2011, when at St. Jude we started our preemptive pharmacogenomic program in-house, we wanted to be innovators, we wanted to be leaders, we wanted for other health systems to be able to follow along, and we wanted to publish our experiences and come to conferences and talk about the barriers and how we're addressing them. But as we looked around, we realized that there weren't a lot of other health systems that had pharmacists that were experts in this field that could pick it up and really implement at that time. And so we realized that we needed to take a step forward in training the next generation of pharmacy implementers. And so in 2011, we started the first PGY2 pharmacy residency at St. Jude in pharmacogenomics. And I quickly worked with other colleagues from around the country, and we petitioned ASHP to create a new specialty area because there wasn't one at the time. And so we were able to work with ASHP and the Commission on Credentialing and very quickly work with them to launch this new specialty area. We became a specialty area by 2012, and now on ASHP's site, when you go to the residency directory, there's currently 7 programs listed across the country, and they're listed here. And I just note that there's only 6 pins, and that's because St. Elizabeth's, you don't have a pin yet, I guess maybe because you're still pre-candidate status. But this is really exciting to see. So we went from not being recognized at all, and now there's 7 active training programs across the country. And so ASHP has accreditation standards that every accredited pharmacy must meet. And so this is, these are standards that really kind of address everything from how you recruit and select your candidates to the program policies, and then the structure, design, and conduct. And so one thing in particular that I wanted to point out is there is a threshold that 2/3 of the activities of a resident during a residency year must be focused on patient care activities. And this is something that discriminates from a fellowship. So you can do clinical research as a resident. In fact, there is a research component that's required, but 2/3 of your activities have to be in direct patient care. There's also some standards about the pharmacy services and your pharmacy department itself, and that pharmacists at your institution must be providing comprehensive care. And there's also, with the new standards that rolled out this past year, there's also some standards about recruitment of not just the residents, but the pharmacy staff themselves for DEI, so that there's equity, that there's inclusion in the recruitment process across your whole institution and your department, and so there's attention to that. So all these standards must be met for a program to be accredited by the body. And then there are a number of specialty residencies. Clinical pharmacogenomics is listed on the website here. And each of these specialty residencies has their own separate competency areas and goals and objectives that must be covered to be in an accredited program. Each of the objectives are classified according to educational taxonomy. And these areas are actually really helpful. They really helped us to design an experience that was very comprehensive. And so there are 5 required competency areas, which are listed here, and they go from patient care all the way through leadership. You do have to have exercises in leadership and practice management, as well as teaching and education, and we've already talked about the importance of that. And then establishing oneself as an organizational expert in implementing pharmacogenomics. And so at the end of a one-year PGY2 residency program, what we're looking to develop is an implementer, a pharmacist who is competent to step into a health system that perhaps doesn't have a precision medicine program and be knowledgeable enough to build one up from scratch. And actually, we're seeing a lot of our resident graduates stepping in and doing exactly that. There are also, a program can also choose to cover 3 additional elective competency areas if you want to, and those are focusing on academia, focusing on initiating a pharmacogenomic service, and then focusing on medication use evaluations if you want to. So then on top of these competency areas, there are also clinical content areas that are required to be covered. So in some form or fashion, over the course of a year, your resident needs to be exposed to these required content areas. Those of us who are training residents refer to this as the appendix. There's an appendix to the competency area document, which gives us all of the topics that have to be taught. And so how we address this at St. Jude's residency is we have a table and we keep a running documentation of any time each of these areas is either taught in a direct patient care experience or case-based application if we don't have a patient population. We keep that running. I keep this documented once a quarter. I give a report back to our preceptors and our resident with everything that we've been covered. We see sort of how we're doing and progressing towards the required content areas so that we make sure that over 12 months we see them all. So St. Jude has had a residency, a clinical pharmacogenomics residency since 2011. We're just finishing our 13th year. We've matched for our 14th resident to start on July 1. So we're on our website and on most programs' websites, you can see a record of who's completed the residency, and then we keep a record of the first job that our residents took out of the residency. And so I just tallied up when I looked at this. I saw that 7 out of our 12 graduates so far have stepped into a clinical pharmacogenomics position at another health system. 3 of our residents have gone on to do fellowships. 1 resident has taken an academic position to teach in a college of pharmacy, and then 1 went directly into a graduate program. So that's a quick rundown of residency training. So as you know, to be a clinical researcher, residency training might not get you there. So fellowship training is another option and another way to go. And so if you're a trainer, a preceptor, and you're thinking about how best to use your resources, whether that's T32 grant-funded resources, whether that's institutional resources, you know, I was talking at the poster program last night with several of you, and we were talking about sort of looking at the gap that you're looking to fill. So are you looking, where do you see a gap? Where do you see more trainees needed? Do you see more pharmacist implementers as being needed? Do you see positions for someone who is able to conduct translational research? And so there are several of our colleagues here who offer fellowship training in lieu of residencies. So fellowships have a different focus. The focus is to develop competency and expertise in the scientific research process. And the goal of a fellowship is that the trainee then should be capable of conducting collaborative research and functioning as a principal investigator at the end of the experience. And there is no accrediting body per se for pharmacy fellowships, but the American College of Clinical Pharmacy has training program requirements. And so for a fellowship, for a training program to be a fellowship, there's a minimum of 3,000 hours over a minimum period of 2 years. that are focused in research-related activities. So this is how we discriminate between residencies and fellowship training, because I get asked that often by students who are looking at their options. I often get asked that. So that comes out to 70% of your activities should be research-related to be a fellowship. You can have some clinical experience, but the focus of a fellowship is definitely on exposing the fellow to research-related activities. And on the ACCP website, there's a fellowship directory. And when I searched for pharmacogenomics specific training programs, 4 programs came up. 2 of them are at the University of Florida. And they're shown here. So so for students who are interested in seeing what their opportunities are, there are directories that are available online where you can direct your students and your trainees to go to find where the experiences are. And so those are 2 really great options. So not every person is able to devote 1 year or 2 years or more towards formal training. There's also a need for, as we've talked about, clinicians who need more exposure, who might be stepping into a role in pharmacogenomics. And so this is where certificate programs in pharmacogenomics are available, and these are really great options. So the difference between a formal training of a fellowship or a residency versus a certificate program, these are programs that are designed usually for practicing clinicians to increase their knowledge and skills in the area of pharmacogenomics. And when I surveyed the ones that I could access online, typically these certificate programs are 20 credit hours or fewer. There are some online and some hybrid options. And as we talked about, for example, for the VA program, which is really, bringing up these opportunities for pharmacists to step into pharmacogenomic specialist positions, a certificate program is a great way to get up to competency. And so here's some examples of the ones I found online. This is not a comprehensive list, but ASHP has a pharmacogenomic certificate that's just under 20 hours. There's the Test to Learn certificate program, which was mentioned yesterday, as well as University of Florida, who have a graduate certificate program. So I just wanted to mention that there are pharmacy departments that send pharmacists to this certificate program. I've also been talking here at this meeting about other programs with other pharmacy departments who have developed their own certificate program de novo on-site. Some people have chosen to do that, and with the expertise that's there to train their pharmacists within their department. So that's another option. So at St. Jude, we have something maybe one step below a certificate program. We have a competency training program for all of our pharmacists. All of our staff pharmacists as well as clinical pharmacists need to meet certain competency requirements in pharmacogenomics. And so this is so that we know that every pharmacist in our department is able to speak the vocabulary, speak the nomenclature, and do some interpretation of test results. And so that's how we've met that. We tie our competencies for all pharmacists at St. Jude into the annual review process. And so there's a competency that needs to be shown and demonstrated each year. So speaking through all of this, just want to bring up the question, is there a role for board certification in pharmacogenomics? And you might have an opinion about this. One thing that I just want to recognize is that with the certification programs that are available, and there are more pharmacists taking these 20-hour certification programs, it can be confusing for a layperson to understand that someone who has a certificate in pharmacogenomics is not someone who's board certified in pharmacogenomics. That's a very different thing, right? So a certificate program that's 20 hours of focused area is very different from a PGY2 program, 1 year, which is roughly 2,000 hours of focused education, right? So the Independent Board of Pharmacy Specialties is an organization that exists to create the testing and the certification for specialty areas in pharmacy. So we are a credentialed career path, and we're becoming more credentialed, and the credentialing is an important role. It's important in the hiring process and the promotion process for many people who are clinical pharmacists. And so the BPS is the board that writes the certification and the recertification exams and keeps people practicing at the highest level. And Kristen already spoke to talking about role delineation for people who practice in pharmacogenomics. So the Board of Pharmacy Specialties can accept petitions by pharmacists for a new area of specialty. And so the petition has been launched that pharmacogenomics is an area of specialty. And so there is a process to this, and so many of us in our inbox received an invitation from the Board of Pharmacy Specialties to, in the next few months, to participate in a job analysis, which is really a role delineation for the board to learn what people who practice in our area are doing, what's our role, what are our day-to-day functions. And so this is the first step towards creating a specialty certification for pharmacists in pharmacogenomics. So it's going to be interesting to see where that goes. So to be a residency program director in a pharmacy specialty area, one of the requirements is that you must be board certified in the area that you're training, if it exists. And so for right now, there is no board certification in pharmacogenomics, and so I'm board certified in pharmacotherapy until that becomes an option, and then any of us that are RPDs for pharmacogenomics residencies will seek to become board certified if, when it gets to that level. So that's sort of one of the emerging things, I think, to show that our field is really, this emerging field is really kind of coalescing together. So in conclusion, there's several training programs. They're very varied. They're varied according to the interests of the trainee, and each of these have different focus and purposes as we've gone over. So I just want to end with a call to action for each of us in the room that training the next generation of leaders is going to be essential to continuing to the trajectory forward of our field of precision medicine. It's going to be essential to everything that we do. So thank you very much.